Hello, my name is Michael Ward, and I'm a doctor in Manchester, and I have been for 30 years. I treated several children who worked in Manchester factories. This is a summary of my interview with the House of Lords on March 26, 1819, about the health of textile and factory workers. So I'm going to give you a little excerpt. I'll tell you what questions I was asked, and then I will give you my answer. First question I was asked was to give the committee information on your knowledge of the health of workers in cotton factories. So I responded, I've had frequent opportunities of seeing people coming out from the factories and occasionally attending as patients. Last summer, I visited 3 cotton factories with Dr. Clow of Preston and Mr. Barker of Manchester, and we could not remain 10 minutes in the factory without gasping for breath. The next question was, what was your opinion of the relative state of health between cotton factory children and children in other employments? And I told them that the state of the health of the cotton factory children is much worse than that of children employed in other manufactories. The committee asked me if I had any other information to give them. So I told them that cotton factories are highly unfavorable, both to the health and morals of those employed in them. They are really nurseries of disease and vice. Vice or bad habits. And then they asked me, have I observed that children in the factories have particular accidents? So I told them, when I was a surgeon in the infirmary, accidents were very often admitted to the infirmary. Through the children's hands and arms, having been caught in the machinery, in many instances the muscles and the skin is stripped down to the bone, and in some instances a finger or two might be lost. Last summer I visited Lever Street School. The number of children at that time in the school who were employed in factories was 106. The number of children who had received injuries from the machinery amounted to very nearly one half. There were 47 injured this way.